54 days since our first case of COVID-19 in Albany County, week 51. So, again, it's been a almost long year, and thank you to everyone who's doing the right thing. So, we're going to get through this. The light's at the end of the tunnel, and we're almost there. There are no new people to report since yesterday, but we did have one person pass away over the weekend, a woman in her 60s, so my thoughts and prayers go out to the family. Again, it's a difficult time to lose anybody, especially harder in these times, and to say goodbye. So our death toll stands at 352 since the outbreak started. Albany County residents that we lost to COVID-19. And to the 352 families, again, my prayers and condolences go out to you. It's hard. It's been a hard year, and it's harder when you lose somebody. And to the people that are recovering from this, again, it's hard because it's a long road ahead of you. And I watch what my brother's going through and the difficulty. Even though you beat it, you get out of the hospital, the lung issues and everything else that you have. It's a long road to recovery. So please, people, be patient with people. And again, we're going to get through this. But as of today, we have 20,562 cases of COVID-19 in Albany County to date. We have 57 positive cases since yesterday, and there were 81 new positives the day before that. So again, our 5-day average is 80.4. Yesterday it was 86. Still continued to be in the right direction. Currently there's 1,511 people under mandatory quarantine. Yesterday that number was 1,498. Of the new positive cases, we now have 17 close contact to a positive case, 3 are healthcare workers, and 37 don't have a clear source of infection. As of today, 64,205 people have now completed quarantine. Of those, 19,951 tested positive for the virus and had recovered. 72 new recoveries since yesterday, which is good. The increase in hospitalizations overnight was 4. 36 people currently hospitalized from the virus. Yesterday that number was 39. We're now at the lowest numbers of residents in hospital since November 13th, and when there were 35 people hospitalized. There are 3 patients currently in the ICU. Yesterday there was 3 patients in the ICU. That number is the lowest we've seen since November 7th, when there was also 3 patients in the ICU. Albany County's 7-day average for percent positive is 1.9%. The Capital Region 7-day average is 2%, which is all good news. We're going in the right direction. Overall, the data continues to look strong, but there is no time for us to be lazy. There's no time to get COVID fatigue. Please continue to wear your mask, walk into your arms, clean your hands, stay 6 feet apart, and we'll continue to get through this. So a couple of the other things I want to point out, some of the new things that have opened up is we've been advocating for is the regional food banks and home delivery mail programs. They're now eligible to get the vaccine. That just came out. And public-facing hotel workers are also available now to get the vaccine. And I know people, more and more vaccines coming out here. Dr. Whalen can probably talk better on it than I can. Johnson & Johnson's being delivered from Louisville, Kentucky today. I believe there's 4 million going out, and probably like 5 or 20 million next week. They're talking about that are going to slowly start to get out there, Johnson & Johnson. So as they keep producing more and the other 2 companies keep putting more vaccine out there, there'll come a point when Dr. Whalen and I look forward to that day when we both sit here and go, hey, we need people to get vaccine. We need people to sign up. That's not the case right now. We have the demand. We just don't have the supply, but the supply is getting better and better every week as it goes by. So please be patient, and your time's going to come. For those who want to get the vaccine, please check your eligibility. Please continue to use the state's website and their hotline, 1-833-697-4829 and 201 with the United Way. Again, thank you for everything they're doing with the United Way. The other thing is I talked to my counterparts, Steve McLaughlin in Rensselaer County and Rory Foreman, the Schenectady County Manager, and we talked about the Washington Armory opening up and the eligibility for appointments, which is the zip codes 12202, 12206, 12207, 12209, and 12210, which is some in Rensselaer County, Schenectady. How do people get there? There's no real parking, transportation. I know that they have a parking lot set up, trolley back and forth. So to Pete Gannon's initiative, thank you. We're going to work it out where we can get bus services and car services for people in respective counties to get them here. So if transportation, please stand tuned for that. I believe Steve McLaughlin will be putting it out and Rory Foreman, but we're going to be doing it in a partnership with them, and I can't thank them enough for the partnership going forward. We want to make it easy. Also, you can use our new pre-registration tool to get people on the list so we can easily contact them when we have the vaccine clinic set up. The pre-registration list is also being used by other providers, as we continue to say, including the state for mass vaccine sites at the Washington Armory. And again, vaccine will actually begin, at the Washington Armory this March 3rd, and we'll continue to encourage people to pre-register and to use it. Also, you can find our link at albanycounty.com. And please use the red bar across the top, which will take you to the COVID page. And we continue to remind people there's the difference between pre-register and actually signing up for an appointment. As Dr. Whalen said more eloquently than me, we had a lot of people sign up for that, over 25,000. That was last week, and it's probably grown. You got to be patient with us. We knew it was going to be a hit. I just didn't think it was going to be that much of a hit, but it does show the need, not just here in Albany County, but every county across the state of New York, especially the 57 counties upstate, to have a pre-registration tool to make it easy for people not to get online to get vaccine. But please continue to work with us. We also announced over the weekend that we'll be getting vaccine doses delivered to homebound seniors thanks to the partnership with Sheriff Apple. Sheriff Apple, thank you. Always on the forefront doing extraordinary things. So this is going to be a great partnership. In the governor's office, thank you, and dealing with Larry Swartz over the weekend on seniors that can't get out, which I've been advocating for a long time about getting vaccines to them. Unfortunately, we have a lot of people like my sister-in-law and other people that can't get out, and they have caretakers come in every day. So this will be a good initiative, and with Mohawk Ambulance to go out to senior houses, deliver vaccines, which is just great success across the board. So we talked about a variety of stuff. So Dr. Whalen talked about the new supplies they're getting, but on top of that, we got more vaccine going to the Sheriff's Department, more vaccine going to other places, and we have a ton of vaccine coming into the county this week, which a lot, in a great partnership. I look forward to working with Schenectady County, Rensselaer. The health department has a lot of great partnerships that Dr. Whalen and her team have set up over the weeks. There's a lot of people out there that need vaccines, so you're going to be hearing a lot more initiatives with the amount of vaccine we have coming in to get it out to the community. But you got to bear with us. It's a lot more than we anticipated, and it's good. It's good. So I want to thank Larry Swartz and his team for believing in us here in Albany County, and to knowing that we can get it out there in a partnership with everybody, because it does take a partnership to get things done. It's not about the egos. It's not about who has the S on their chest. This is about getting shots in people's arms, and every shot we get in someone's arm is closer to us getting back to some type of normalcy. So again, and getting the people that need it. I'm glad to announce all these new initiatives, but I will say this, we still have to address our frontline workers. Like Dr. Whalen's team got it because they're out in the front line, is I have a lot of workers that are out in the community that are very essential to my operation here in the county, from water purification to our security guards, to our DCYF employees, or to our DSS employees. I could go on, that aren't eligible. So as we make other eligibilities to restaurant workers and Uber drivers and Lyft drivers, please, let's continue to open up to everyone. But I want to remind everyone, you have an obligation to educate yourself, meaning that we're restricted. So, and Dr. Whalen can talk about this. She's very restricted, and we are at times, of what we can vaccine and what we can't. And that's why when we do 1B, and people are like, you got to open up to restaurant workers. No, we're told that we have to get school teachers and firefighters and police, and that's what we have to concentrate. Now with people on underlying health issues opens it up. We couldn't do 65 and above. There comes with a lot of restrictions. It was the same thing when I said on Friday, people need to educate themselves about nursing homes opening up. I know you hear one thing, people hear that magic word, and that's all they care about. I just heard what I wanted to hear, and I didn't listen to anything else, okay? So please educate yourself, read up on it. We do put it out. It does put us in a bad advantage, because people are like, well, why can't I come there? And we have to explain to them, or they sign up through our pod and they didn't read the every reason, and they get through our pod and they get to the control. Let me tell you, I will say this again to the media, please go down and see the operation that Dr. Whalen and her team run. It's very impressive, the amount of people they put through, but the controls they have in place. And when you get to that, and you can talk about this because I went through it, but when you get to that one lady, you might stand in line and you might have beat the system to get on, but they're double checking everything and they will turn you away. And again, we don't want people to have hard feelings, but you will also have to be honest with yourself how you filled that thing out to get to that point. And do people fall through the cracks yet? No, we're not, it's not perfect operation. No one has a perfect operation. But please, educate yourself, and we'll get through this, and we'll continue to get through this as we vaccine people. And so the other reason, too, is that we put together our first PSA on the subject a while back, and I'm happy to say that starting today, we have a second running PSA commercial throughout Albany County area. Dion Lewis, the New York Giants running back and Albany native, was nice enough to help us out with a video to encourage as many people as possible to get vaccinated. The video was put together by local firm marketing, Adam, who did a really nice job. Adam, thank you. Let's take a look at the PSA commercial with Dion Lewis. It's only going to be 30 seconds. Well, sorry about that, but the audio is a good PSA commercial, and we'll have it up and running and done right. But again, sorry about that. So again, it's Dion Lewis, who is an Albany native and an icon of the area. He's been such a great partner with me over the last 9 years, and to his mom, to his family, who've been a fabric of the community, where they all grew up on 2nd Avenue, Huffman, and to him being an inspiration to people. Thank you, Dion, for what you're doing and continuing to do for the people of Albany County and New York State. So thank you again. But please sign up and get vaccinated. That was the point of the PSA, if you could hear the message, was to encourage people to go and get the vaccine and why it's so important to get the vaccine. But again, speaking of vaccines, we also got some good news starting this Thursday. The state has given the green light to vaccine those over 65 and older, which is great, and that's why we've got more vaccine coming in. Before this, we were only able to do 1B, which we talked about. So again, continue to advocate and open it up. It's getting there. So thank you, thank you, thank you. And to the governor's office, thank you. And again, to Larry Swartz and them. It takes a long time sometimes to move a mountain, but we've gotten there, and we'll continue to move whatever mountain we need to get the vaccine for the people of Albany County. Dr. Whalen.
Good morning. So the good news is that we continue to see cases decrease across the county, and there's a lot of factors for this, not all of which are known. We are seeing people sign up for vaccines, which is good, and as we start to look at the vaccination data, the percentages by zip code of those who have signed up are indicating where we're doing well and where we need to continue to improve. We're following those numbers and plan on continuing to work with community partners on ensuring an equitable vaccination distribution. We are very pleased that this week we did receive an increased allocation for the over 65 population. We will be hosting a pod today and also Thursday, and may be announcing an additional effort in the next day or so as we plan for the supply that we are anticipating. I do want to mention that at this point, most of the population are familiar with the fact that we have so far had 2 vaccine preparations out. These are Moderna and Pfizer. The Moderna vaccine is a 2-dose vaccine that is administered on day 0 and day 28. The Pfizer vaccine is a 2-dose vaccine that is administered on day 0 and day 21. These vaccinations have been available across the Capital District in various amounts, And we're pleased yesterday that the FDA did announce an EUA for an additional vaccine, which is the Johnson & Johnson vaccine. This is a single-dose regimen, which will be attractive to a lot of people because it is a single-dose regimen. So individuals that may find challenges with getting back for a second vaccine may find this an attractive option. It, like the others, has undergone rigorous clinical trials. It is safe and effective. In terms of the efficacy, we know Moderna and Pfizer are in the 90 percentiles for how the level that they can protect you against severe disease and death. So those are very reassuring numbers. The Johnson & Johnson vaccine in trials in the United States has shown about a 72% efficacy. This is still very strong efficacy. So, I want to reassure the public that as we continue to get vaccine out, as more people are immune to the effects of COVID-19, and that is some people have had the infection and have variable immunity, and some people have had the vaccine and have immunity. We are looking at, for herd immunity, a level of about 70%. So this is targeting where we want to be. It is still a very effective vaccine. I know we often talk every year about flu vaccines, and for a flu vaccine, 70% would be a pretty good number. So, I do want to reassure the public that this is another very important tool in our armamentarium, and as we start to get supplies of that, we will be pushing them out in the community as well. So this is something we are looking forward to. We are looking forward to continuing to increase our efforts to work with our Medical Reserve Corps and with community partners and with our partners particularly at the hub, which are the hospitals and the local health departments in the capital region, to increase strategies to get vaccine out in the community. So I thank everybody for their, the interest. As the county executive indicated, we do have a large group of people that are pre-registered, and we are working through those lists. We are not the only people that are pulling from those lists. So as vaccine becomes available in pharmacies, in some providers' locations, in various levels, others will be utilizing that list to continue to ensure that we have, we are registering people that might find it difficult to do so on the internet. This is our commitment to you. We will continue to do this work and continue to ensure that we're doing everything possible to get the vaccine out in the capital region.
Dr. Whalen, thank you. And again, thank you to your team. And, just to kind of put the light at the end of the tunnel, you got to think about this. Every time she does a vaccine, they have to come back 4 weeks on one, I believe 28 days, and then 21 for the other. Well, if you vaccinate all through March, that means all through April they're going to be here. If they do it through April, all through May. And I will attest to that her department for the last year, and all of our departments in the county, been working at maximum force. And again, it's going to take a while. And to her and her staff for their dedication, thank you. People get tired. It gets tough out there. And but we continue to need to find solutions to the problems, work for the people, and a partnership to get things done. Again, like I say to everyone, leave the egos at the door. It's not time for that. You want to take a glory lap when it's all over with? Great. Dr. Whalen and I need partners, and we need partners in the community to get the vaccine out and testing and everything else. On Friday, we announced the mental health initiative. Again, to OCA, thank you. It's been a long 5 years to get this done. But to the Judiciary District of the City of Albany, thank you. And again, this is going to be a game changer for a lot of people. Can't thank them enough. I want to remind people, too, please, Whitney Young is not going to be doing testing anymore because really now we're getting more vaccine. They're going to be turning their operations into more and more getting the vaccine out there. They've been a great partner. They will test individuals one-on-one if you call to make an appointment. but they won't be doing it like we set up. But again, to Whitney Young, thank you for the first partnership and for the continued partnerships going forward, and to Dr. Whalen herself and her team for making it continue on with Whitney Young. Again, that's what it's about, and things are going to change as we go forward. Please use our website, like I said earlier, for appointments and testing times and all that stuff. Our mental health is always available 7 days a week from 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. Karen Ziegler and her team again. Thank you for what you do for a lot of people in the county. It's a difficult time. If you have any concerns or questions, 211, and then New York State hotline, as always, 1-888-364-3065. And again, people, continue to wear your mask, cough into your arm, clean your hands 6 feet apart. We're getting through this, and I'm hoping March, as the weather improves, we just don't loosen up and stop putting our guard down. I can assure you, Dr. Whalen and I do not want to go backwards. These numbers have been great, and I want to thank everyone for doing the right thing. Stay safe out there. I don't know if there's any questions.
County Executive McCoy, you mentioned that there were more populations that opened up for vaccines. Could you just repeat which ones those were? And then also, I remember originally you said that you were going to hold off on taxi, Lyft, Uber drivers, and I think restaurant workers.
Correct.
Are
Yep.
you now opening that up for those groups?
Well, Dr. Whalen and her team, and she can answer this, opened up for people with underlying health issues, so it doesn't matter where you fall. They're the ones that should have been targeted in the beginning. They're the ones that were honestly falling victim to passing away from COVID-19. So, no, restaurant workers, school teachers, whoever, Dr. Whalen can say it better than me. That's open to anyone with underlying health issues. But it was the regional food banks and the food pantries and home delivered meals now that have opened up. And we have advocated for that because, unfortunately, go to these food pantries and you see lines around the corner. It will break your heart. So I'll say to the viewers out there and the listeners, please donate food if you can. Even if you can spare, a can of soup. It's going to make a difference in someone's life. So we've been advocating this for the exposure level that they'll receive in public-facing hotel workers. They were the new guidance that just came out.
For vaccination clinics, you said that you received additional doses this week. How many, and is that federal allocation, or is that catch-up from the winter delays?
So what I referenced was an additional supply that we received for the over 65 population of Moderna, which was an extra 500 doses.
Should people expect, besides the Thursday clinic, when you said links open up Tuesday night, you said there could be another pod happening this week for that extra allocation. Should people look for a link at any certain time, or what do you recommend?
So I think that's something that we're still in the planning process, and we'll announce as soon as we have more information.
Good morning.
Morning.
Since the J&J vaccine is only one shot and its rates aren't as high as Moderna and Pfizer, does that affect how it will be distributed here in the county and who gets it?
So, this is something that we learned about over the weekend, and I imagine that there may be some additional guidance coming from the state that we have not yet received. We will, as we get supplies, pass it out like we do every other vaccine. I don't know that we're going to be targeting any particular group with that. We want to make sure that we have equity in getting our vaccine out across the county. So that will be something that certainly is considered with this, like it is with every other product.
So if someone says, hey, maybe I'd rather wait for the Moderna or Pfizer, what would you tell them if the Johnson & Johnson were available right now? If someone was like 65 and older and wanted something a little bit stronger.
Yeah, so it's not necessarily that the Pfizer and Moderna are stronger. It is just that their clinical trials slightly increased efficacy. I do think that 70% protection is certainly much better than being vulnerable to COVID-19. So I would encourage people to get vaccinated when and with what that they can.
and how much the county will be getting of the vaccine?
So like everything, we only find out week by week. So there isn't any planned allocation at this point, and we're discussing internally what we would be requesting.
Has the acceptance rate improved at all amongst county employees, such as members of the Sheriff's Department? I know there was a bit of an issue early on with that.
So I don't have data in terms of the Sheriff's Department on who's interested in vaccine. And at this point, we know that we still have issues with. And someone said to me the other day, we talk about vaccine hesitancy. A better term is vaccine confidence, because we want people to be confident in the vaccine. We know that still is a concern, particularly in communities of color, and we look to continuing our educational efforts for those partners around the county. That will be something that we continue to need to work on, because to date, our vaccination rates do not match the demographics of the county. So we need to work on that. But in terms of, at this point, figuring out by individual employment groups who did or who didn't, we have so many people that are interested in getting vaccine that we're focused on getting vaccine to those that are interested, and still working with the communities that we know hesitancy is increased. As time goes on, there'll be more educational efforts as we learn of more populations that are having concerns with it.
Chronologically, now that we have the Johnson & Johnson vaccine approved, what is the turning point for when we are at the point of trying to convince people that they need to get it, as opposed to the supply not meeting the existing demand?
Don't know. We're not there yet.
And for the county executive, we have like a month left before April 1st, before the state budget is finalized. Does that in any way factor into your plans or your sort of reluctance to announce official plans for the county moving forward for the following year?
Great question as always. I think under the charter, I have to deliver the state of the county by the 13th of March. So I will be doing it probably by the end of this week or Monday or over the weekend to put it out there. I was hoping that the stimulus package that just passed the House for $1.9 trillion or 1.6, I forget, and got through the Senate, because it's going to give us a better foundation going forward with a lot of relief and money for health departments for responding to COVID-19, and where I'm going to stand going forward as a county.
Also, concerning April 1st, because it's the state budget deadline, that is also the policing reform deadline, and it seems like we don't really have a clear idea of what that's going to look like. It's not your department, but it's under the county umbrella. So will Sheriff Apple be coming back at some point to sort of explain that? Because he did appear here to give sort of clues about that previously.
Yeah, no, I'll get him back on to talk about that and the initiative with homebound seniors. It's a good point. I saw his plan, and a lot of these, I don't want to speak for him because he does a great job. A lot of these initiatives he's already implemented over the years. So again, as we go forward, I'll have him come in before April to talk about it.
Do you have a reaction to Governor Cuomo's statements coming out last night about the further sexual harassment allegations?
Listen,
I think multiple statements.
Yeah, no, it's the allegation of sexual or misconduct must be given full seriousness, and it's what I said. I think it was either Channel 13 or 13. I think it was Daryl's question. I called for it on Friday. That's why I didn't put a statement out, that we need a full private investigation from outside tentacles of government that can be a fully independent inquiry of this misconduct, and especially after seeing what happened over the weekend and last night, it is disturbing, and we need to address these issues in a timely manner and make sure that everyone is heard.
On the local law capping third-party delivery fees, is that an incremental step towards something else, or is that for all intents and purposes a finished product? Because some of the arguments that restaurant owners make say that really the existence of third-party companies generally is detrimental, but the cap is not low enough as far as what they can charge.
You know, as far as I know, you know, we did everything we can in a partnership, and we will continue to listen to the restaurants and to make sure that we're working with them. So if there's any issues that you just brought up, I will reach out to the Restaurant Association to find out. I know what we've written was a lot more restrictive than other counties in the state. We want to make sure it's fair, and at a time where these restaurants need our help the most, we don't need government hurting them, we need government helping them, and if I need to add on to it, I will. Any other questions? Is the Dion PSA, is the audio working, or I like to run that for everyone. Nope, never mind. Second time the failure. But again, please, when it gets out, it will have audio, I promise you. And I will say to everyone, stay safe out there and do the right thing. Thank you.